Gentleman yields back. Pleasure to recognize the gentleman from Massachusetts, Mr. Kennedy, for his 5 minutes of questions.
Dr. Bright, thank you very much for being here, and thank you for your service to our country. Let's ground this hearing a little bit. As of this morning, which means these numbers have increased, there's nearly 1.4 million cases diagnosed with COVID-19 in the United States and over 80,000 fatalities. Experts believe both of those numbers are an undercount because after 5 months of this virus being on our shores, we still have a systemic problem with regards to robust testing. Is that right? Cases in many states across the country are still actually increasing in number despite that lack of testing. Is that right? You mentioned in your testimony that, quote, we missed early warning signs and forgot important pages from our pandemic playbook. Is that right?
Yes.
Sir, you've been the head of BARDA since 2016. Is that right?
Yes.
Until recently. Have you experienced any pandemics prior to this one over your course of time, either there or in your prior government service?
We responded to the Zika outbreak. We responded to the Ebola outbreak. They didn't rise to the level of pandemic.
Of course not.
Yeah.
Right. Thank you for the clarification. Sir, you're aware at the end of the Obama administration, the Obama team put together a playbook to try to guide succeeding administrations on how to handle an outbreak, correct?
Yes.
Sir, you're also aware that there's a simulation done from an outgoing Obama administration in January 2017 with an incoming administration about how to respond to a pandemic. Is that right?
Yes.
And you're aware that the Trump administration cut the number of CDC staff located in China from 47 to 14. Is that right?
I don't know the exact number. I know it was reduced.
Okay. And sir, you referenced already the simulation called Crimson Contagion. That was a simulation done by HHS and begun in January of 2019. Can you shine just very briefly a little bit of light as to what the findings of Crimson Contagion were?
The significant findings, it was actually the participants were beyond HHS. It covered broad areas of government and federal and state and locals. Some of the significant findings were the need for improved coordination and communication and alignment between the federal and state, local, tribal, territorial governments, and the significant need for personal protective equipment and the shortage and a significant need for funding initially.
And sir, that simulation was based off of a flu-like virus that was initially detected in China, spread by global air travel, and resulted in the infection of 110 million Americans, leading to 7.7 million hospitalized and nearly 600,000 dead. Is that right?
Yes.
Sir, when did you first have concerns about the potential impact of COVID-19 on the United States?
In early January.
And were you aware that your supervisor, Dr. Cadlick, suggested that the activation of the Defense Production Act in mid-January?
I wasn't aware of him doing that, no.
Okay, well, you mentioned that you had 2 meetings with Secretary Azar. I'm sure you had others, but you referenced so far in your testimony meetings on January 23rd and 27th, where you raised concerns directly to the Secretary. Is that right?
Yes. The Secretary was not at the second meeting. Deputy Secretary Hargan was there.
Thank you. You're aware that top National Security Council staff, including National Security Advisor Mr. O'Brien and his deputy Matthew Pottinger, raised significant warnings that China was downplaying the impacts of this virus.
I did learn of that in the meeting at the White House, yes.
You're aware that we sent 17.8 tons of medical supplies to China in early February.
I've learned of that.
Are you aware that the Trump administration budget proposal released in February of 2020 called for a cut to CDC by nearly $700 million?
I'm not aware of that. I've heard of it.
Are you familiar with a memo written by Peter Navarro that warned of the impact of the virus?
Yes.
Are you aware that it was spread among senior administration and White House officials?
Yes.
Are you aware that it was on or about April 2nd when the Trump administration finally activated and expanded the Defense Production Act, months after being warned by you and other senior administration officials?
I've learned of that.
Are you aware that that order itself did not extend to the full authority of the DPA and left a haphazard allocation process to states and hospitals to compete against each other?
I don't know the details of that authority, sir.
Has the Coronavirus Task Force actually developed a plan for reopening the country?
I'm not aware of the full plan to reopen, sir.
Have they developed some principles that the White House has touted as some principles or guidelines as to how to reopen the country?
I've heard of some principles.
Are states following that plan?
It doesn't appear that there is a nationwide coordinated plan that states are following, sir.
So after this recitation of the actions and inactions of this administration over the course of the past 6 months or so, can we possibly say that this administration has prepared our country for the moment that we are in, and how we could possibly be prepared for the distribution, development, manufacturing, and distribution of a vaccine to try to address 330 million Americans over the course of the months ahead?
I think we have a lot of work to do to be prepared, sir. I think we're fully prepared.
Thank you, sir. Yield back.
Gentleman yields back. Pleasure to recognize the gentleman from Missouri.